Well, when I grew up in a small community in Alexander City, Alabama, and family is very important. Our faith is important. I have a son, Brandon. He's 37 years old. He's what keeps me grounded and keeps me going. I have congestive heart failure and AFib, which is atrial fibrillation, and I've got to have a pacemaker put in. And since I've been retired, it's just been one thing after another with my health.
When I became aware of Miss Mizerany's needs as far as being able to get to the doctor and not being able to afford the copay, I knew that the Hospice and Home Health Fund of Alabama would be able to help her with those needs. And so I made that request for her, and with that, talking with her some more on the phone, discovered some other things that she needed help with, and came out to visit with her to see how we could help her further.
I'm living kind of like in a dangerous home environment, and my social worker and Alacare, it's just come to my rescue, really. And if it wasn't for Alacare, these things wouldn't be taken care of. And anywhere I walk in my home, it's so unstable. You know, it could be a very serious situation, which it has been. I fell in the back portion of my mobile home. The floor actually just went through. The only thing that caught me was the carpet. If I had went straight through, I would have been in real big trouble. And so I was able to crawl out of that, and I had to actually crawl my way back up to the front, because at the time I thought that my arm might have been broke, and I was having chest pain because of the trauma from the fall. And when the fire department got here, my Alacare nurse got here about the same time, and it was just God working. From there, they were, talking with each other and had worked it out to where both Alacare and the gentleman and the fire department union and their church are going to come to my home and with Alacare's help repair my floors, which is more than, I'm just so sincerely grateful. I could not begin to do it on what I bring in monthly Social Security and to do the type of work that's needed to be done to make it livable, so there wouldn't be a danger to me, falling anymore and other things that could happen simply because the floors are very unstable and are rotting through. And that's how it's been done. And it's through God's grace and mercy and the good people of Alacare and the Northport Fire Department employees that are willing to come out and help me.
The Hospice and Home Health Fund of Alabama is a great benefit for us as social workers that work with Alacare to be able to help meet the needs of our patients that maybe have limited income. The Hospice and Home Health Fund of Alabama is a great way for the patients to be able to sort of bridge that gap between meeting their medical needs, some of their psychosocial needs, even just helping to improve their quality of life and their safety in their home, like in Miss Mizerany's case. It gives me a good feeling to know that when I come into these homes and I see these patients that we're able to help them with what their need is.
For people on a limited income and who are elderly and disabled, your generous contribution that goes into this fund helps people such as myself. It's people that would not otherwise get the help that they needed, or the food that they needed, or the repairs that they needed. It means so much to me that you're giving me a safe home. Your donation is just giving me a safety net of a livable home to live in. I love you for it. Please keep all of us in mind and keep your heart open, and please generously donate. It's going to a good use. It's been spent wisely, and it's been gratefully and warmly received from me, and I appreciate it.